For as long as she can remember, Paola didn't like her nose. But how much did that insecurity shape the decisions she made?
BeautySeek is not a medical provider. This is not medical advice. Always consult a licensed professional.
Hello, Paola. Thank you for joining us today. You have had rhinoplasty. Share with us, when did you feel in your life that maybe you might like a bit of a different nose?
For as long as I can remember. I think it was during my teenage years when I felt it the most, but honestly, I think it started when I was really little. I never liked my nose. It was always kind of a dream to get surgery, to be able to change it, but I can't say exactly when it started. It wasn't a specific moment because I grew up with that insecurity.
Okay, perfect. What did you feel? Like, show me on your nose if you can. What did you feel were the areas where you wanted a little change?
Mainly, this specific area right here had like a small noticeable bone, a bit of a bump, and it was positioned really quite low. So, yeah, it was mainly this part that I wanted them to lower and lift up a little more.
Beautiful, beautiful. Simple asks, right? Well, how did you feel? What was your internal dialogue as you kind of went through life and you knew you wanted to make these changes? How did you talk to yourself?
I looked up a lot of information, I did a ton of research. I joined different groups, reached out to different girls who had already gone through the process. I made the decision when I was really young. I told myself I was going to get my nose done. I didn't have the financial means at the time, but I did do my research and I knew it was a whole psychological process. When I actually went through with it, I also worked with a therapist who supported me in making this decision because honestly, it's the center of your face. So I think it really was months of preparation. But even so, when I finally made the decision, everything happened really fast.
Paula, I'm so impressed that you included a therapist in your evaluation. I think it's so important to make sure that we're making these decisions for the right reasons and we understand the emotional weight that we're kind of playing with when we make a decision that is about the center of your face, as you say. I think it's a great example to set.
Yeah. And mostly because in the groups I was part of, there's something called body dysmorphia. So people who had good results with their nose still didn't feel comfortable, didn't like it, or complained about the surgeon. So a lot of the comments were like, well, I think you need a psychologist more than surgery because there's a bigger issue there. So I didn't want that to happen to me. I didn't want my insecurity or my fear to keep me from seeing the real results. So that's why you have it. And in fact, there are surgeons themselves who recommend that you go to a therapist. So I considered it very important. And that's why I made that decision.
Paola, on a scale of 1 to 10, 10 being the highest, how much did you want to change your nose?
How much did I want to change my nose? Yes, 15.
Okay. 15 out of 10. I love it. Okay. So very much. And you went through the emotional therapy and you made your decision. Where did you then research to find the surgeon that was right for you? What was your process to research?
I looked up a lot of profiles on Instagram and Facebook, and I also asked a lot in that community I was part of, like for doctor recommendations. I researched a lot of surgeons, got quotes because I asked about the cost of the surgery through messages. Some told me it depended on my case, others already had a set price. So I picked the ones that were within my budget and went with the doctor whose work matched what I wanted most because every doctor has their own way of working. So I saw that doctor and thought, he does noses like the one I'd like to have.
Is there anything, looking back now after having rhinoplasty, is there anything you wish you had known before the procedure actually took place, the surgery took place, or do you feel I had as much information as I needed?
I think I did know that. Well, even I didn't expect that 4 years later, there would still be days when it looks different. But no, they're not really big changes or anything. But no, there's nothing that I think I did really good research.
Okay, great. And just in terms of that research, it sounds like you're in some Facebook groups, likely around rhinoplasty. What in your so you're hearing questions happening in those groups. Can you recall anything that you think, gosh, the members of those groups, they might have considered asking these questions, like they were missing this type of question about the procedure?
I think so. There were people who went ahead with surgery without doing proper research, and that's why they either had bad results or don't see their nose the way they want. Because you also have to mentally prepare yourself for your type of nose, your face, the kind of face you have. I can't ask for a result like a nose I saw on the internet when that person's face isn't the same as mine. Maybe their face is slimmer, more delicate, so they have the chance to have a finer nose, or their skin is thinner. Mine was thicker. So a lot of people fall into that misinformation, saying, I want this kind of nose. And if I don't get this kind of nose, it was a bad job. So it's about asking the right questions, doing the right research. And you have to realize that not everything depends on the surgeon, but also on you knowing what kind of nose you have and what kind of nose you can realistically have after surgery. But even so, when I finally made the decision, everything happened really fast. And I do feel like maybe I should have given myself more time between meeting the doctor and the surgery because it all happened within a week.
She knew she wanted to change her nose, but choosing the right surgeon would be the next challenge.